The 10 drill questions below are both here and at the end of the chapter. Welcome to Chapter 6. This chapter shows how you can help the office run smoothly. Tasks include opening the office, checking messages from the phone, email, and fax, and cleaning the reception area. Once patients start arriving, you must greet and assist them. Throughout the day, you'll need to answer phone calls, write letters, and complete paperwork. Most offices are locked at night, so your first task is to unlock the office and turn off any alarm. Then, prepare for patients and visitors. Your early morning jobs include checking voicemail or emails or faxes that come through from the answering service. Listen to each message, making sure to record in a phone message book the name of the person who called, the time and date, and what the caller wants. Redirect the phone from the answering service to the office. Next, print 2 copies of the day's appointments and place one on the provider's desk. You can also have the appointment page of an electronic calendar ready. Use the second copy to pull medical records for patients with appointments. If you use electronic medical records, make sure the provider knows how to access them. For paper records, make sure there's enough room in the progress notes section for the provider to record what happens during the visit. You can add an extra sheet for notes. Now, make sure the front office is free of any obstacles that could impede or trip patients or employees. Check the restrooms, making sure they have toilet paper, soap, and hand towels. Clean the reception area. Straighten magazines and make sure the sign-in sheets are in place. Sometimes the provider's business cards are put out for patients and visitors. Make sure there are enough for the day. Double-check that prescription pads are available for the provider and that they are out of sight of patients. Providers using electronic health records can print prescriptions from the computer. Turn on necessary equipment, such as computers, laboratory equipment, copy machines, and all lights in the exam rooms. When turning on the computer, make sure a backup system for files is in place. Prepare the patient accounting system for the day. This includes balancing the day sheets, securing enough encounter forms for each patient, and checking that the amount of petty cash available is correct. One person needs to order supplies. Keep an inventory so you can order supplies as they run out. To help with this task, use a spreadsheet to record all the supplies that the office uses. The document needs to include the name of the item, the number of items in stock, the usual price per item, and any bulk discounts. Then follow these steps to determine when and how to order. First, decide when to replenish. Highlight those items to alert office staff. Next, review the spreadsheet and determine what items to reorder. After you place the order, note the date and quantity in the appropriate column. When you receive the order, note the date and quantity in another column. If you only get part of the order, make note of the items that are on back order and keep track until the rest arrives. Repeat the inventory and ordering process each month. Periodically ask staff for suggestions about specific supplies that need ordering. To purchase supplies, most providers establish accounts with suppliers. If possible, pay off the balance each month. Complete these tasks before closing. Check that there are no patients left in the facility. Walk through all exam rooms and treatment areas to make sure they're empty. Turn off office equipment and take care of any other housekeeping chores. Lock file cabinets that contain patient records. Run account reports and balance the day sheet. Get ready for any bank deposits that you need to make. Switch the phones to the answering service or voicemail. You need to be courteous and respectful to every patient. Greet each one by name if you know it. In most cases, it's best to use the patient's last name and title, such as Miss Jones. Have a staff member at the reception desk at all times. After you greet a patient, find out whether the visit is for an illness or a checkup. Then have the patient sign in. It's also important to ask whether the patient is new or if he's been to the office before. If the patient is established, pull his chart. If the patient is new, you may need to have him complete new patient paperwork, unless he did so before coming into the office. Try not to keep patients waiting. Do your best to bring the patient to the exam room for treatment or consultation close to the time of her appointment. If there's a delay, let the patient know and tell her about how long the delay will be. Explain any delay longer than 15 minutes. Long waits can cause patients undue fear and anxiety, so it's important to schedule patients as efficiently as possible and do everything you can to put patients at ease. The telephone is the main communication device for most medical practices. Most patients make their appointments over the telephone, so it's essential that you be warm and welcoming when speaking to patients. Proper phone etiquette can help build a medical practice, whereas inappropriate etiquette can drive patients away. You can consider telephone calls a key part of your workday. Never view them as an interruption or an annoyance. If you do, the patient will notice. Most calls come from established patients calling for appointments or to ask questions, new patients making a first contact with the provider's office, patients and medical workers reporting treatment results or emergencies, other providers making referrals or discussing a patient, or laboratories reporting patient information. Speak in a pleasant, friendly voice when answering the phone. Speak clearly and pronounce each word separately and distinctly. Don't speak in a monotone voice. Use inflection or a change in pitch and loudness as a way to emphasize certain points during the conversation. Avoid jargon, talk slowly and naturally, and avoid phrases such as "uh-huh" and "you know." It's also important to be tactful when on the phone with a patient. That individual may be worried or agitated. Part of your job is to attend to the patient's needs and make her feel comfortable. If you're busy when the phone rings, take a few seconds before answering the phone. Then you can answer graciously without seeming breathless or impatient. After you pick up the phone, identify the facility and then give your name. There are numerous greetings you can use. Some providers prefer a formal greeting, while others allow a more casual opening. Here are some examples.
This is Dr. Simmons' office. Mr. Myers speaking. How may I help you?
Simmons Maternal Health Clinic. This is Sarah Myers. How may I help you?
Karen Simmons' office. This is Mr. Myers. How may I help you?
Dr. Simmons' office. This is Sarah. How may I help you?
Some providers don't want their staff to say doctor in their greetings. This protects the patient's privacy in case the call is going to an office where calls aren't always private. It's still important to identify the facility so the patient knows that the call is from a medical provider. If a caller doesn't provide identification, ask who is calling. Ask the person whether she's a new patient, an established patient, or a salesperson. Then write down the name on a phone message pad. Repeat the name during the conversation to make sure you got it right. If the caller is a family member of the provider, a protocol is generally in place to interrupt the provider to take the call immediately, or as soon as he finishes with a patient. If the caller is another physician, the protocol may be to interrupt. In other practices, the provider may call back at the end of the current appointment. You, a nurse, or other staff member will return most patient and pharmacy calls by the end of the day. Sometimes a caller refuses to give her name. When that happens, make every effort to identify the individual and find out the reason for the call. If the caller still refuses to identify herself, suggest sending a letter to the provider that you mark as personal. This request usually gets the person to give her name. Next, find out the reason for the call. If it's a patient who wants to talk to the provider, find out if the provider is available to talk. If not, politely ask the patient to leave a message. Try to get a sense of a good time for the provider to return the call. If you need to transfer the call to another staff member, give that individual a brief reason for the call before transferring it. When the conversation is over, end it in a pleasant manner. If a caller chooses to wait on the line instead of waiting for a callback, make sure the person doesn't wait too long. Don't let more than 1 minute go by without checking in with the caller to give her an update. If the wait is too long, the caller may decide to leave a message. If you take a message, make sure to get all the relevant information, which includes name of the person calling, name of the person whom the caller would like to talk to, the caller's daytime, evening, and/or cell phone number, reason for the call, date and time of the call, and initials of the person taking the call. Another option is to transfer the call to another staff member who may help the caller. For example, if the caller has a billing question, you may want to transfer the call to the person who handles billing. Carefully write all letters, memorandums, replies to inquiries, responses to requests for information, telephone messages, emails, transcriptions, orders for supplies, and instruction. Your correspondence should be concise, but not curt. Present all the relevant information clearly. As a CMAA, you will write most correspondence at the computer. Microsoft Word is the most common word processing software. It's important to know how to use this software to compose letters. Some offices have a standard form or template that you can use as a model for letters. These are usually in a Word file with the label Templates. When you need to write a letter or other form of correspondence, go to this file and find the template you need. Then rename it and proceed. Prepare your rough draft using your desired letter format. Full block, in which all letter parts begin at the left margin, is generally preferred for professional correspondence. But other formats include simplified and modified block with indented or blocked paragraphs. Follow these steps to write a business letter. First, what's the purpose? For example, do you already have a letter that you need to respond to? Next, write a rough draft. To help you, a business letter usually contains these parts: a heading. This includes the letterhead and the dateline. The printed letterhead is usually in the center at the top of the page. The opening. This consists of the inside address and the salutation. The inside address includes the name of the individual or firm to whom you'll be sending the letter and their address. The body. Here is where you'll describe the reason for the communication. Sometimes you can use a subject line. such as regarding insurance claim at the beginning of the letter. This alerts the reader to the purpose of the letter. The closing. Here you'll write a complimentary closing, type a signature, reference initials, and any special notations. If you use a first-name basis with the recipient, you can write cordially, very truly yours, or sincerely yours. If the letter is more formal, use sincerely. Typing a signature serves as a courtesy to the reader, especially if the name doesn't appear on the letterhead or the signature is hard to read. Place reference initials of the writer and typist below the signature that you type. Special notations indicate that enclosures are in the letter or that copies need to go to others. You can indicate this by using the word enclosure or the letters ENC. Type this right below the reference initials. The copy notation is usually written as CC: or copy to. Make sure you use proper grammar and spell everything correctly. Name and save your file. Proofread a copy of the letter that you print. Use proofreader's marks to make corrections, and then make any necessary corrections. Print it out and allow the provider or other relevant staff members to proofread it. Make any final changes, and print the letter on stationery. Depending on the nature of the letter, either the provider or you will sign it. The provider signs these kinds of letters: those dealing with medical advice to patients, those to officers or committees of medical societies, referral and consultant reports to colleagues, medical reports to insurance companies, or personal letters. You will usually compose and sign these kinds of letters: routine matters, such as arranging or rescheduling appointments, orders for office supplies, notifications to patients about surgery or hospital arrangements, collection of delinquent accounts, and letters of solicitation. Letters aren't the only type of correspondence that you'll compose. There are many other kinds. One may be telephone messages. When taking telephone messages, you need to include name of the person calling, name of the person whom the caller would like to talk to, the caller's daytime, evening, and/or cell phone number, reason for the call, date and time of the call, and initials of the person taking the call. Emails are a popular form of communication. You should write them in the same style as business letters. You can save and print them for a patient's chart and archive them. You can also print and track emails that are pertinent to a patient's care or show a pattern of missed or canceled appointments. It can be difficult to make sure emails are secure, so you may decide to write a traditional letter so that you have more control over confidentiality. If an email contains private information, include a disclaimer. While you're at work, it's a good idea not to send personal emails. If you need to, use a separate account. Emails that you send or receive on a business account are tracked, so don't engage in any communication that you don't want your employers to see. Some employers require employees to sign a statement that explains acceptable use of email and the internet. You could lose your job if you don't follow your facility's policy. All faxes need to have a cover sheet. It should say that it's confidential and only for the person to whom it's sent. Make sure you proofread it and that it's grammatically correct. Only send a fax when it's absolutely necessary or when the information you're sending doesn't breach patient confidentiality. Include a disclosure when sending faxes. You can also call ahead to alert the person who is going to receive the fax. This helps the fax go to the right person. Memorandums are the last form of communication. They can be paper or electronic and may discuss when the office is closing, the need to order supplies, and other information that's pertinent to the office. Memorandums need to be clear, concise, and professional. Make sure you apply proper postage when mailing letters. Most standard size envelopes require a first-class stamp. Always weigh the letter if you aren't sure about postage. Use a roll of stamps when mailing a series of envelopes, so you can add stamps at the same time. Tear off about 10 stamps and fan fold them on the perforations so that they separate easily. Fan the envelopes address side up. Starting at one end of the fanned envelopes, attach the stamp at the end of the strip, tear it off, and proceed to the next envelope. Automated sealers and stampers are also available to make this procedure easier. It's important that you know the basics about computers. Each day you'll need to write emails, send a memo, or use the internet. Many offices use Microsoft Office. This software package includes an email system, word processing, and a program that you can use to develop spreadsheets. The email system, Microsoft Outlook, can sort email by date, subject, sent and received messages, and order of importance. You can attach documents to encrypted emails that you send to patients, providers, and suppliers. Outlook also has a calendar function. You can use it to track staff meetings, times when the provider is out of the office, times when other staff members are on vacation, and days when the office is closed. Microsoft Word allows you to format and create documents. For example, you can create different colored headers and use the Insert function to add tables and charts. It's important to be familiar with Word for writing letters and memos, as well as reports and progress notes the provider might need. After creating a document, name it and store it in the appropriate electronic folder. It's a document because it has the extension .doc or .docx after it. Microsoft Excel is a program that creates spreadsheets. These can help you store patients' health information, including reports from laboratories or medical centers. When you make an entry, it's essential that you do it carefully and accurately. You must enter all data as it's made available. Because confidentiality is such a big issue when dealing with patient information, some practices take extra precautions to make sure that information remains private. Firewalls, which are similar to filters, only allow certain types of data to enter or exit. You can add encryption, which means information is a code, and the documents can only be read after you remove the encryption. These precautions help protect this very sensitive information. The Internet is another tool you'll use to order supplies and conduct research. When conducting research, it's important that you know which websites are reliable. Information from sites such as the American Heart Association and the American Medical Association are reliable, as are government websites such as the National Institutes of Health and the Centers for Disease Control and Prevention. Your practice may have a website, Facebook, or LinkedIn. You can use these social sites to make announcements, such as when the office is closed or when a provider is away. Because so much of providers' information concerns patients, they must follow security procedures and adhere to regulations set forth by HIPAA. HIPAA regulations protect patient information. You can only use and share it for these reasons: for patient care and treatment coordination, to pay providers and facilities for health care among family, friends, and relatives whom the patient identifies as being a part of his health care, to make sure you're providing good care in clean facilities, to protect public health, and to make reports to law enforcement officials. In most cases, providers can't share information without patients' permission. Specifically, the provider can't give information to a patient's employer, use or share health information for marketing purposes, or share mental health information from counseling sessions. Providers must train staff using a computer about what information they can and can't share. Individual computer users need their own login names and passwords. All staff members must use their login name and password every time they use the computer system. Don't access patient information unless you need something specific from a patient's file. Be careful when releasing information. Only give the necessary information to accomplish a task, and remember that all software programs track when you access information. It's illegal to access information about a person because it's available. Always ask the office manager if you have questions. Equipment that offices use during a workday may include copiers, fax machines, printers, and scanners. You need to know the basics about using each. Copiers print multiple copies of documents. Maintain copiers so copies are always crisp and clear. Replace or refill the toner cartridge when necessary. Fax machines exchange data through telephone lines. You need to take precautions when sending a fax. Verify the correct number, direct the fax to a certain person, and use a cover sheet. Fax machines need to be in secure areas to prevent unauthorized access to health information. Scanners capture images of text and photos at high resolution. You can use them to create electronic copies so you can store paper documents. After you scan and create a document, you can send it out by encrypted email. Printers can print files from a computer or can be part of a fax, copy, and scanning device. Many all-in-one printers have photo quality printing, print on both sides, and have wireless connectivity. In this chapter, you learned about many of the basic tasks that you may need to perform during a work week. These include preparing the office for the day and closing up at night, greeting patients and asking for relevant information, using proper etiquette when talking on the telephone, creating letters and other forms of correspondence, and using the computer system. The next chapter discusses medical terminology that's important to your job as a medical administrative assistant, including how prefixes and suffixes can help you understand certain words.